Hello. So this week I'm going to be talking about the postpartum adjustment period. As you can imagine, after having a baby, there's quite an adjustment period. I think a lot of the times we don't realize how much of an adjustment that it can be because it's a lot of hormonal adjustments and fluctuations. So postpartum blues is a term that's used to identify emotions after the baby's born. About 80% of people go through what is defined as postpartum blues. It's not necessarily a depression, it's just mainly like the hormones are fluctuating. It's the body's response to like the variation in hormones, emotions, and the physiological changes in the body. So there can be, and there's a lot of contributors to this, such as fatigue. With a newborn baby, you're not sleeping a lot. And then, it's just a feeling of overwhelmness also. So all of that can contribute to mood swings and crying, just kind of being teary-eyed and things like that. And that's fairly normal for about 80% of people in the first couple weeks after giving birth. Once that first couple weeks has passed, it's not as normal for people to still have those feelings. About 2 weeks after the baby is born, if the symptoms are still persistent, the birthing person should really be evaluated for a postpartum mood disorder. And there's a lot of different disorders that can come with that. Depression can be one of them. That's just one of several, though, and I think that one gets a lot of attention, but probably not as much attention as it should, because this is one of the most common overlooked postpartum complications. So depression's more of like losing interest in the baby, having some sleep difficulties, appetite changes, feeling of hopelessness, feeling of isolation and guilt and things of that nature. There is a higher degree of a postpartum mood disorder called postpartum psychosis, and that includes hallucinations, delusions, rapid mood changes, not just mood swings. I mean, just going from an extreme high to an extreme low, paranoia, confusion, things of that nature. Someone who's suspected to have postpartum psychosis should definitely be seen immediately. That could be a threat to their self or their baby. Some other postpartum mood disorders are postpartum anxiety, and that the symptoms of that is more like excessive worry, sleep disturbances, physical symptoms, restlessness. The physical symptoms are more like a hypervigilance and things of that nature. And then there's also obsessive compulsiveness, and that the characteristics of that are like checking things multiple times, obsessively cleaning, and then like hypervigilance. And a combination of all these symptoms can happen in the first couple weeks, not necessarily the hallucinations and things of that nature, but mild versions of this can happen in the first couple weeks and be fairly normal, and then life kind of resumes back and your hormones and emotions are more stable. But it's the couple weeks beyond is whenever you're looking for these kind of like extreme disturbances in your life, and you want to be evaluated for any type of postpartum mood disorder. Another one is postpartum panic, and that has symptoms of fear of dying, doom, dizziness, things of that nature. And then there's PTSD. A lot of people suffer from PTSD from their pregnancy or their births, unfortunately. And that has symptoms of anxiety, flashbacks, avoiding situations where you would normally feel okay. I know like a huge trigger can be like noises, stimulation like that. And like kind of like detachment. So those are several mood disorders that can come with postpartum depression, and should definitely have a further evaluation to make sure if someone is suffering from any of those mood disorders, that they get the help that they need. And if that's through the midwife getting a referral to a psychiatrist or a therapist or something of that nature, that's definitely recommended. So there's therapy. You can just go to like talk therapy and talk through some of these problems, or then you could also see a psychiatrist for medication to help with the depression symptoms, anxiety symptoms. Peer support groups have been shown effective, and then just support in general. Not having too much expectations on yourself right after you give birth, and having a support system in place before you give birth can make a huge difference in the postpartum period. One of the main things is just not putting too much on yourself, not too much stress on yourself, which is hard, and getting enough sleep is hard, and making sure you're eating properly and things like that. But it really is important to try and set some time aside for yourself and take care of yourself, because having a newborn is a basically 24-hour job. So if you have the ability to set some time aside for yourself, take a walk or whatever, that's a good method to reduce these symptoms or the potential for these issues to arise.